Nirupama's lecture. She presented nice anxiety state. Ayurved, there is Vat Pitta Kapha. Vat Pitta Kapha. We have got psoriasis, psychosis and syphilis. So, what Jayashree said was all technical. Technical in the sense that those who were interested, they would have understood it properly. But I was listening to her in a more detailed way, and I am ready to go to her, learn about it, because I have got so many cases of cancer, so many cases renal failure, so many cases that are coming from Ayurveda, allopathy, and those who are not getting the answer, I am giving the answer in a better way. I feel everybody. I have written a book on cancer can be cured. It's again a challenging book according to, and everybody can get surprised to see that cancer can be cured. Because in that book, I presented about 10 cases before and after. The photographs are already available there. Today's lecture was diabetes and delusion. Same book is coming up soon, diabetes and delusion. Why diabetes and delusion? One more thing, before that, I want to say that because of Dr. Qureshi, who presented and forced me already, Dinesh forced me already to come over here. Otherwise, I was not ready to come over here. Because now I am now 74 running, on the verge of going into 75, and you may have observed that I am now trembling, internally as externally. I hope Nirupama may be having some experience, old age trembling. So rubrics are there, old age trembling with anxiety. So she was the topic of anxiety. Anxiety, whether it belongs to sore or syphilis or psychosis. Anxiety belongs to psychosis, fixity. It becomes fixed, the opinions becomes fixed, fear begins at the acute stage, and it becomes chronic. That chronic stage is psychosis. What is in short, I want to say about 3 miasms. One is sora, second is psychosis, third is syphilis, and we are advanced Ayurveds. Because we have entered into a nanotechnology. Hahnemann has done it 300 years back. Now we are thinking about nanotechnology, nanoscience. With this introduction, I say that sora, psychosis, syphilis is the 3 better 3. What is sora? Sora is deficiency. Sora is deficiency. Whenever you are not normal, there is a deficiency inside me also. What is that deficiency? I am trembling because some factors are deficient in me as far as the old age is concerned. So I may be in that soric state. Second is excess. Anything excess can be psychosis. And then deposition. Excess and deposition. Next book that I am going to come across is heart attack. Knockdown, bypass. We can knock down the bypass also. I have got 3 or 4 cases who are advised 100% bypass only. Even doctors at Mumbai, they said that tomorrow you have to undergo bypass. Because of that 40 years or 47 years of my experience, people are believing me. They take the last opinion of me sometimes. One fine day, he called me at night and said that my father has been asked to undergo bypass by 3 renowned physicians and cardiologists from Mumbai. What should I do? I said, come to Kolhapur. Last 3 years, not with homeopathic medicine, he is well. He was not able to walk even about 100 feet without chest pain. Now he can walk a distance of 3.5 kilometers, 5 kilometers without any problem. And then the deposition that has taken place as a psychosis, we can say. This psychosis has been improved. And not only this, there are about 3 or 4 cases. I don't advise such things to everybody. I advise these things only to those who have got tremendous faith with me. Otherwise, it's a risk. Nobody can say that suddenly you avoid these things, because not that all DM cardiologists are not wrong in all respects. They have got their own situation. Like we can say that allopathy doctors are always in a soric state. They always frighten you. Maybe there may be different reasons behind it. but frighten you definitely. And then our patient goes into a state of sora, which is shifted. When it becomes more chronic, it becomes psychotic, and then perversion, then diversion, that goes into syphilitic state. So today, why I say chosen this, my sugar is under control. This PowerPoint has been created by my assistant. I have not gone through it because I was very busy with my patients, and my sugar is under control. She missed, I think she was in a delusion. She missed one word important, delusion. My sugar is under control, delusion. And then whether it is a delusion or whether it is a fact. The delusion I can say because whenever I come across with so many sugar patients, they always say, those who are normal, those who are having no problems, no complaints at all, they say, generally say that my सब कुछ ठीक है, सब कुछ अलबेल है, I have nothing to worry. Why? Because my sugar is under control. So this is a delusion I say, that my sugar is under control, that means it is in a suppressed state. I always say to such patients, you are always on an atom bomb. Anytime, anything, it may go into a psychosis, it may go into a perversion state, it may burst, and it is a life-death situation. I always say, go to a homeopath, go to Ayurveda, get yourself corrected, because you are on a delusion, a false thinking, taking medicines without knowing whether the insulin level that he discussed in Ayurveda. He nicely discussed about it. I don't want to go in that details. So I always say to them that you are under a delusion. You are not right. Because if you are taking any medicine, that means you are ill always. Repeated use of medicine leads to chronicity. And chronicity is an atom bomb where you are sitting over it. So this is why I said that delusion. Now who is that created? Who has created this delusion? Who has created this delusion? Let anybody answer. One more thing, that how many of you are diabetic? Anybody of you is diabetic? Because all young people, I don't think that not many. How many of you are diabetic? Anybody diabetic over here? What tablets you are taking? You are also diabetic. You are under treatment? Regular. Which type of medicine? Metformin. What? On and off. Now, on and off?
Medicine will take on and off.
On and off. Regular. So what is the idea? What is your feeling?
After giving food therapy, I will control this diabetes.
So you can control the diabetes. So again he is saying, these are the patients which we are coming across. I think all of your doctors, they may be getting this idea only that my sugar is under control. I may do this, I may do that. When it is going to happen? So, they forget for some time. So this is the thing, that is a delusion created by the researchers. They have got lot of hypotheses. What is that diabetes? Diabetes insulin. I said that stage 1 insulin, that is juvenile diabetes, when insulin is not formed. But I have one more question to you, that there are certain children who we come to know that they are diabetic at the age of 11, 12, 13 years of age.
Even some born children are
That I am kind to that.
Because in their case, beta cell is not functional. Pancreas, we have beta cell, it is not functioning well, and they have C peptide level is 0.01, 0.02.
Oh.
So insulin is not produced automatically.
What I want to say again, a little bit ahead of it.
Yeah.
We are getting juvenile diabetic patients sometimes at the age of 13, 14, 15, 16.
Yeah.
What about how is it that we are not knowing that they are not secreting insulin? How long they have survived?
For that only, sir, I gave that we have to step up a little further. We need to get, apart from fasting, PPDS and HbA1c, we should also get done beta cell function, that is HUMA-IR, and C peptide level.
I am not talking about your pathology.
No.
I am talking about a child who we come to know about as diabetic, But what about the previous to that? What about the condition of the patient? That means that certain children are secreting their insulin,
Yeah. So their level.
and then suddenly something goes wrong, and they land into juvenile state. You understand what this I want to speak? Huh? I don't want to dishonor you.
No, I'm not doing that.
हाँ.
Yeah. It happens.
ये सोचने के बात है कि सोचने के बात है कि supposing you would have been from birth, you would have started at the beginning. I have got one of the case now recently about 1.5 year, a cancer child, also diabetic, at just 1 year of age. It was a tumor over here back, and that tumor has gone within 58 days. When I first observed that child, the child was also diabetic. The insulin, the sugar level was very high, about 130 or so at a child. We started the medicine, homeopathic medicine, the tumor is also going inside, and the sugar has gone to normal. That means the insulin has been started secreting. That means that there is something wrong in the child sometimes, and because of that the islet cells of the no काम नहीं कर रहे. So there is one experiment in homeopathy also. Alexon has been tried. Alexon has been tried with potentized. Such patients, the beta cells get destroyed or they are not working. Then such patients, if given certain patient given Alexon in potentized form, sometimes they may start working that pancreas. This is the experimental stage. So the next is the delusion is created by researchers. That so many hypotheses. Everybody is confused. So diabetes, a metabolic disorder, medically disorder, understood in two ways. What is diabetes? As long as the patient is not saying any symptoms, they are not presenting any symptoms, they are well. They well. So that is before that state. When the patient comes to the doctor and examines from some other reason, then they come to know that they are diabetic. So this is, they are not having any pathology behind it. That pathology which is they are not having, that means they are not in a disease state. What is disease? Disease is not at ease. Not at ease. Disorder is a person has no symptoms, but investigations are positive. Disease, a person is not at ease, experiencing. There are two changes. What is functional changes, and second is pathological changes. Tissues are not involved in early stage, and second is pathology singular or multiple tissue involvement is there. So that means you are in three stages: a normal stage, the second is disease stage, and the third is disease stage. Normal state, when nothing has happened to you, you are healthy. You are not having any pathological, nothing. All laboratory reports are normal. Disease stage, where it starts, but that doesn't mean that he is diabetic. So that is the place where Ayurveda and homeopathy have the role to bring down that thing to normalcy. People don't come to us in proper time because of the hammering that is there. That only we are the only scientific people in this world. The modern science people think that we are the only scientific people in this world. That is, they also put us into a state of delusion that I am okay and these medicines are going to keep us all right. And that is a delusion. And I want to say that you should come out of that delusion. And this Ayush people has to do a lot of work in this regard. So disease, I already said, the external discovery. The disease and symptom presentation characterized by words, signs and symptoms. I don't want to go in detail. Let's go and discuss about it. What is disease? What is disease? But beginning to that, when in early stage, when you start, you always have to check, it's okay, but you should not go under the delusion. Because I have seen, I'll just go into the next. So diabetes characterized by insulin absence, severe deficiency, diabetes 2, maturity onset. This has been discussed by Ayurvedic well-known doctor from. So I don't want to go into that detail. Next. So there are hypotheses and hypotheses. Some say it is the cardiac problem. Some say it is the sugar problem. Some say it is a protein problem. Some say it is the. So who is the culprit? Diabetic care involves many different ideas and approaches. What matters most is choosing one that makes sense and sticking with a clear plan, even while experts continue to explore and debate. Today I could learn from Ayurveda Today I could learn from Nirupama that we have to jointly do efforts to bring down the delusion of so many people who are going into diabetes. Doctor from Ayurveda told in the morning that about 20%, 27% are diabetic. I say that within coming years, 50% would be diabetic as long as you are in a delusion state. So you have to shake that delusion, bring out that delusion. You also think that you are not under control. You are under control. You are still in a delusion state. You have to find out if you are going to Ayurveda, they can manage you according to Ayurveda. If you are going to homeopathy, they can manage you in the homeopathic way. We have to find out the constitution. Then acutes we have to treat. We have to treat. I treat in the layer. Whatever that is presenting at this moment is important to come to the rubric, and then I can come to the conclusion of a remedy. So the layer theory. First layer is over, second layer is over, third layer is over, fourth layer is over, then cure. You come out of the delusion. So you can attend there when you are in a problem. So we are being confused. A lot of reports we are following. The research is important. Then secondly, our medical students are also equally important. We are giving more importance to MBBS. We are going to more importance to post-graduation. And so they are also in a state of delusion. And when they come out of the delusion, when they come across so many failures in their practice, when they come across so many failures but they can't say that I don't know. Supposing cancer specialist can't say that he can't treat cancer. When I as a homeopath, as a Ayush person can say, because I have seen it, then I have got results, I can say that I can cure cancer. I can't with challenge say, oncologists cannot say that he can cure cancer, because they are on wrong footing. They are keeping people on a delusion state. They are always forcing the people, and because second, the money that getting, that is also maybe a pharmaceutical problems. Third, if you are supposing I am MS, MCH, oncologist, and I have wasted so many years of my study, so many money I have wasted, and then I can't say that I don't know anything about cancer. A diabetologist cannot say that he don't know anything about diabetes, because he can't say like that, because he has wasted so much of money. And what about the knowledge that I have gained? I feel it has got no foundation at all. It is foundationless. Then next, so then we have to come why. So it is the individuality. We and Ayurveda and Homeopathy, we are holistic people. Holistic people, and then we take into consideration in the mental state, whether it is what state it is, whether it is acute state, whether it is soric state, whether it is psychotic state, whether it is the syphilitic state. If I have got cases which are, I divide the cases of cancer into syphilitic, soric, psychotic, syphilitic, but syphilitic, mild syphilitic, moderate psychotic, severe psychotic, syphilitic. From this we can convert into psychotic state. From that we can to mild, come to the soric state, and then we can expect cure. Not necessarily that it is all right, because I have got results in cancer within 6 months, 4 months, they have got totally cured. So there is no, this is the place where individuality has got. This is the place where individuality has got. So I feel that this patient of diabetes may take 2 years, and I give the medicine, and within 15 days the patient's blood sugar goes to normal. And I have seen patients that the blood sugar has not raised. That is the chemia of, what is the peculiarity of homeopathy, because it is a nanoscience. It not only works at the extracellular level, it works at the intracellular level. Intracellular, it enters the medicine because of the minutest dose that we are giving, and so we cannot predict how the patient is going to react. Here the role of individuality is there. So we can say that diabetes, modern medical research heavily relies on statistical evidence, yet is often overlooks the vast disparity in individuals, mental and physical. Nowhere in allopathy we come across any holistic approach. So it is a total suppressive therapy. If you are a suppressive therapy, nobody can cure you, you are on the very wrong footing. Whatever that is there, it's a matter. Treatment of matter. Homeopathy, Ayurveda, not only matter, mind also is important. Now, what about supposing we are treating matter? We are treating matter. What about the sensations? What about the feelings? What of the delusions? What about the dreams? There is no answer in such situation. No answer at all. So we are half-hearted. So there is half side. Matter 1 plus 1 is 2 is in mathematics. 1 plus 1 is in only in matter. When what about the mind? I feel that this patient is going to be okay. How she is looking at? Maybe that she is knowing that such a type of person, such a type of person. I feel that it belongs to the Silisha group. This feeling that I am having, it may come from a long experience, short experience. From long experience, I can say that this is the patient. That is my feeling. How can you judge that feeling in mathematics? You cannot judge that feeling in mathematics. You cannot judge that feeling in sensations. I can't say that people come with tingling numbness. The other day I had a patient with renal stones, repeated renal stones in a child. Every 15 days the child was operated for number of times. They come from Satara and very remote area. And it was a bothersome situation that a child of this age getting renal stones. They came to me with faith. And then I took the case history, everything. For first 15 days I couldn't come to the judgment. The 16th day I could find that there was some eruptions which are very chronic on the palm. Child, there was no mental state much, not very intelligent, going to a normal school. People were not also, there was studied that the child should learn. So there was no mental stress in that child. But the repeated stone formation was the problem. This patient came to me. I saw this, and from that I didn't consider the stones. And it was petroleum. Petroleum was given. Next 15 days, stones have vanished. Now 1.5 months ago, no repetition of stones, not a single stone in there. And only petroleum 30 was the dose. So here is the holistic approach. I want to say there was no mental state in this case, right? There was a physical state. So not that always matter doesn't matter. Because matter many times matter. And so allopathy works because of matter to a certain extent. But it becomes chronic, then it goes into a very difficult stage, incurable stage. So many people from diabetes are entering into intensive care units. Why? Because they are not treated properly at proper time, and they are not treated on the basis of holistic approach. Holistic approach was not considered at all. So is the case of diabetes. When the diabetes begins because of the tendencies, cancer begins because of the tendencies. Not everybody chewing tobacco will have a cancer of the cheek. Not everybody smoking will have a cancer of the lungs, because it is a tendency towards that. And homeopathy, even Ayurveda, may be in a position to rule out that tendency. So this is the place where the very moment you should ask your patient not to go for allopathy unless and until there is emergency. Whenever there is emergency, allopathy is the best. Sometimes, not always. So, because we are making the disease chronic, I always say that modern medicine is not, is a factory of chronic disease. Factory of chronic disease. Okay. So, next slide. So, individuality is given importance. When the individuality is given importance, we can come to the right diagnosis, right treatment. Not only that, according to what Pitta Kapha, psoriasis, psychosyphilis, what stage is the patient, we have to give that antipsychotic remedy. We have to give that anti-syphilic remedy, then a cure is possible. We have to give such a remedy which will cover the pathology also, which will cover the psychosis, syphilis, psoric state also. Those things, everything covered, that can only be done with holistic approach. Next. This is UD, 1 minute. Back. Bring back. The UD, I just rush now. EGDP reports a harsh reality. Such reports have been not exposed in the society. That time we have to go for that. We have to present the report and bring it to the surface. Then only people will know. And there are very top many oppositions for our reports. They will say it is not even scurvy. I can say that scurvy was detected as bleeding of gums in the sailors, and it was very fatal. the people used to die with scurvy. And then one day James Lind discovered that by giving oranges, the scurvy goes away. This he reported in the booklet in scurvy. It is in the 17th century. The scurvy, but it was neglected. It was neglected, and 40 years later, the importance came into importance of it. Another case is Ignaz Simivis, I think, in the 18th century, who came forward with cleanliness, hygienic methods. He was considered at that time as a lunatic. And he was considered as a lunatic. And so, all these reports. So, what I want to say, that even though you are coming with definite reports, you should have strong backing for that, so that the reports will be accepted by the society. People don't accept it. And the third is herd immunity. We are like herds. Like herd. We follow whatever that others are saying. Even though researchers say that this is scientific, but it may be, most of the time, it may not be scientific. It is just theories just presented in diabetes. So theories, it is not science. But we follow a science. We go on giving insulin. When the insulin level in the blood is already there, we go on pushing insulin, and then we are making the case worse. So in this report, first is reduced. What is the 1 year report? The sugar level was reduced. The first is only on diet, and this was tried only on diet and exercise. Second was with selected insulin. Only 20 units, 30 units was given. It was for the whole group. And third was the measured insulin was given. Initially in this stage, raised rates, everywhere it was raised, and insulin need also increased. 5 years down step, it came down, and then at the 12 years, the death rate was measured. The death rate was minimal in those who were not taking any medicine. So another thing is that you should not go for medicine. Don't suggest medicine immediately. Go for diabetes. Find out the root cause behind it. Because every illness, nothing happens in this world without a cause. Every illness has got a cause. And in causative factor also, when I take the history in Niruma, I give more importance to the causation. Then from the and then the layer. Causation plus layer, coming to the conclusion, then we get the right remedy. So this is the report which says that not giving medicine is also sometimes good in diabetics. Next report. Next. Another group, that is placebo strict diet, group B, anti-diabetes diet. No diet restriction. So this one also shows that placebo was in a better side than the anti-diabetic over a long run. Long run mein placebo therapy was in a better side. Those who are not taking care of diabetes, they are moving forward, they are in a better state. Next. So this is a perspective of Dr. Jeffrey Gill, with the British diabetologist, a famous British diabetologist. He says that absolute proof that good glycemic control can retard or prevent the development of complications has not yet been obtained, but the assumption is accepted by most diabetologists, and indeed is almost an article of faith in the current approach to achieve the best possible diabetic control. So present scenario, you are saying, I am under control, my sugar is under control, I am free, that is only a faith. एक धर्म सारखा है, just like religion. Modern medicine has become a religion than science. They say that they are science. So in the religion, sometimes we can say something like Nicholas Copernicus said that the sun, earth moves around the sun. This was challenged by Bible, Dharma. So is the case today also. That the present scenario is they are challenging us, and we can't do anything as Ayush people. We are just following them. Second, so I have seen that diabetes, just like there is a disparity between disease and death. Vinoba Bhave has said, Karl Marx had said that there is a disparity between disease and death. Okay. Now, there is a disparity between complications and diabetes. I have seen patients having very high sugar, still there were no complications. I will show one or two patients. This is one of patient who was 10 years back, सूर्यवंशी नाम का है, उनको चेस्ट पेन था, लेफ्ट साइड चेस्ट पेन, thought it was to be a angina pectoris, severe pain was there with fever. He was admitted in the cardiologist hospital, and they came to know that it was lung abscess on the left side. Lung abscess on the left side. Everything for 1.5 months the patient was in coma and he was in the collapsing state. Then I was called for. Went home. Which was that site which was having lung abscess? In Kent's repertory, lung abscess, there is only one on the left side lung abscess. There is only one remedy, is calcarea carb. Went home, gave the calcarea carb. Second day, it was Saturday. Second day, nothing was coming from the pipe. So the cardiologist and the chest physician thought that it might have been blocked. In the evening, he started despairating because the oxygen level was only 40 or 35 that time when I saw. Next day evening, it raised to 50, 60. Third day, he came out of his unconsciousness. He came out of the consciousness. And then, with the same remedy, still he was, when he was admitted in the hospital, cardiology hospital, the sugar level was 450. With calcarea carb, the sugar level came to 250. It remained, still he is alive. It is the case of 2010. Still he is alive. But sugar level has not gone below 250. But that means the body has got an adjusting mechanism. Everything adjusting mechanism. Just like we know how long we can jump. The Olympic people have a positive thinking. So with positive thinking, they can have marvelous heights, jump to such a great height. That is the thing that अपने हमारे जो अंदर में जो है ताकत को हमें मालूम नहीं है. We are not aware of it and we are not using it. So people say that lung capacity is so much, but we are using only 10% of the lung capacity. So that is the thing. Second, so he came out of this. Second one of the cases, another case of old person had diabetes, had a gangrene of the heel. About 80, when he was 85, they approached me. The orthopedic surgeon said that we have to remove the leg above knee. He came running to me. I said nothing doing. I started with lycopodium. He became well. Diabetes was around about 250 or 210. He survived next up. He died at the age of 94. The heel got healed. But the diabetes was not up to the mark as per the standards. And then it shows that complication has got nothing to do with blood sugar, because this is a wrong understanding. There are a lot of intrinsic mechanisms going on which are adjusting our requirement, and we are interfering with the adjusting mechanism of the body. So we go on interfering with the adjusting mechanism. So then we fail, and then we create our own complications. A doctor created disease is more prominent than a man-made disease, because doctor has become more superior than a simple man. All doctors, not Ayush doctors. Because Ayush doctors, I feel that with this my examples and telling you all of these things, that you are going to think in a different way, different approach, so that you can approach your patients in a different way, so that most of the Indian patients at least are going to get benefit from it. So don't consider that complication of diabetes is really related to raised blood sugar. So these are two examples where raised blood sugar has nothing to do with the diabetes. The illness that atomically went away, that doesn't mean that those two patients having normal sugar which we expected. According to me, all in America, blood pressure, in other countries, blood sugar, what is the normal level of blood pressure? Nobody knows. Not a single book about blood pressure has been written in the textbook. This has been created by insurance company at America, USA. I'm supposing there are less number of patients coming across, and the target is not complete. They can reduce the blood sugar level and the hypertensive level lower, so that more number of people come into the grasp of the pharmaceutical companies. So you think over it. So the next, you have given me a lot of time. I want to
Thank
say
you.
Thank you to the Ayush for giving me an opportunity.
Thank you.
Again, finally, I say, sir, I want to say that don't think that complication is different from the sugar level, because we have not understood the sugar. Exactly. Because lot of intrinsic mechanisms are there, and we are mostly interfering the intrinsic mechanism. So is the case with death. There is a disparity between death and disease. I have seen a case, very bad case, in my early stage of practice about 25 years back. The lady I felt was having diabetes, was having hypertension. I was also young. I was not also experienced person like today I am not. So fully swollen, everything was. अभी थोड़ा सा खाती थी, लगता था कि 2 मिनट में 1 घंटे में मर जाएगी, 2 मिनट घंटे में मर जाएगी. 6 months she survived, and she had a peaceful death after giving my medicine, homeopathic medicine. Whatever that was exercise to manage that with homeopathic medicine, the lady survived for 6 months, and I congratulate the people at home that cases did a very good service in that. Nursing care was wonderful for that. Because of that.